Good afternoon. I'm Paige Alexander, CEO of the Carter Center. And on behalf of everyone here, I'd like to thank you for joining our conversation today on mental health. It's also the launch of our celebration honoring former First Lady Rosalynn Carter's 50 years of mental health advocacy. As everybody is aware, 2020 has been an extraordinarily challenging year. For a great many people, these challenges have put mental health in the spotlight. We're coping with the fear that we or someone we love will get the coronavirus, the stress of homeschooling children while trying to do our jobs from the kitchen table and worrying about their stress, the loss of jobs, or grief over separation from loved ones. 2020 has been a particularly hard year on people of color who continue to be traumatized by systemic racism. One positive outcome of this year that has made more people willing to talk openly about mental health needs and mental health care. Mrs. Carter's been talking openly about these issues for 50 years now. She's the co-founder of the Carter Center and created the center's mental health program almost 30 years ago. The distinguished panelists we have gathered here today will talk about her legacy and how we are building on it as we face these unprecedented challenges. To get that discussion rolling, we'd like to show you a short video highlighting Mrs. Carter's work through the decades. Thank you for joining us and enjoy.
I've worked on mental health issues since my husband was governor of Georgia, which is a very long time. I worked on stigma and tried to overcome stigma because it holds back progress in the field. People don't get help when they need it because of stigma. And when we came home from the White House, I knew I wanted to continue that work. I'm really proud of it. We have a great program here at the Carter Center. To me, one of the best things that's happened in my mental health work is a program to educate journalists about mental health issues. We call it Mental Health Fellowships for Journalists. I want my mental health work to carry on even after there is no more stigma, which I'm not sure will come in my lifetime, but I hope it will. But even after we don't have stigma to work on, there's always going to have to be a lobby to get the services that we need. And I think it will still be very important for the mental health community to come together the way they do now. We have a great opportunity to change things forever for everyone with mental illness. The solutions are truly within our reach. We can overcome stigma, and we can make services available to all who need them and offer every individual the chance to create a happy and fulfilling future.
Good afternoon, and thank you all very much. This is Jason Carter. I'm the chair of the Carter Center Board of Trustees, and I'm honored to be here today. I will note at the outset that in true 2020 fashion, many of us in Atlanta have no power. Others of us have power but no internet, and I have finally found a place that has both. So we are excited to be here today. We're particularly honored to have Congressman Patrick Kennedy, the co-founder of the Kennedy Forum, and a great, vocal, effective advocate for mental health care. And then two of our incredible mental health program staffers from the Carter Center, Kari Cobham and Sammy Kumar. Kari heads up the mental health journalism program, which my grandmother mentioned, and Sammy is the associate director for our Liberia and global mental health work. As you mentioned, and as you saw in the video, my grandmother has been working on these issues and has been speaking about these issues everywhere she's ever had a platform. And she was a true visionary 50 years ago in attacking stigma, in addressing issues and trying to bring parity to the system. And again, in 1971, when my grandfather was the governor, she had an official position for the first time as a member of the Governor's Commission to improve what they called services for mentally and emotionally handicapped Georgians. We have made great progress, as you all know, over those years. But one of the most remarkable aspects of my experience as the chairman of the Carter Center Board with my grandmother herself and her impact is in 2018, we went to London for the first Ministerial Mental Health Summit, which was an international group that came together to discuss this issue at a minister level from all over the world. And I have, in many occasions, as you might expect, been introduced as Jimmy Carter's grandson. But this was the first time that people really were running up to me and wanting to shake my hand and talking about the fact that I was Rosalynn Carter's grandson, and the impact that she has had in this field, the leadership that she has shown. I know she's watching today. And so this is a celebration, we call her Mom Carter, of your 50 years in this work. And it also is a moment for us in 2020 to continue on that work and to look at this moment 50 years on from your beginnings and where we are today. So we look forward to having that conversation. We look forward to celebrating you. And in that note, let me ask Congressman Kennedy, say thank you again for joining us and see if you'll share a few thoughts on the 50 years of Rosalynn Carter's leadership in the field of mental health.
Well, thank you so much, Jason. When you said that you've spent most of your life being introduced as a grandson or either of your grandfather or grandmother, I can relate to that, obviously. Being a Kennedy getting elected to office, it had nothing to do with my good looks and personality, right? To be able to achieve public service as I had a chance to do because of the platform that I was given. And so that's why I'm so grateful for you, Mrs. Carter, really seizing that opportunity and creating something so valuable to this space. You and your husband together through the Mental Health Systems Act really rewrote what our expectations should be in designing and building a kind of mental health system that would serve all Americans, and to do it comprehensively. That has been the missing piece really in our approach to addressing those with mental health. You took your experience as First Lady of Georgia and took it into the White House as First Lady of our country. And since then, with the Carter Center, I have to say, as someone who followed your footsteps when I left public life to continue my advocacy for mental health, the Carter Center was the keystone, the foundation for all of us in the advocacy world. You would convene us. And as was said in the introductory video, you brought us together. And that is such a valuable role that you've played. As you know, too many of our fellow advocates are siloed by the diagnoses that they advocate for or the special pieces of this mental health world that they're trying to add and fill in for. But you take the holistic approach. And in addition to that, I have to say that the journalism piece is such a unique contribution. No one had really touched that in this space, and you've just embraced it and really made it an effective part of our overall approach. If we're not addressing public attitudes and perceptions of these challenges, we're really not going to be able to translate that into popular support for major changes in public policy. We need greater literacy, especially amongst those who are shaping our nation's opinions on mental health. And that is what you do through the Carter Center. And I'm glad to be joined by two of your distinguished fellows who are making a big difference. But in conclusion, thank you, Jason. And I thank you, Mrs. Carter. I'll never forget you coming to the Hill and testifying on behalf of the Mental Health Parity and Addiction Equity Act. You were swamped with press as you came in that day to the Rayburn building. I'll never forget it. And it was right in the midst of a very heated presidential primary by then Senator Clinton and Senator Obama. And of course, all they wanted to know was who you were going to support in the primary. And I remember in such a deft political stroke, you said, "I support Patrick Kennedy," which of course was the great, and everybody got a good chuckle out of that. Most notably, my father, I might add. And I will just say it showed your political acumen. And that was the reason why the press came in and then covered your testimony. If you had said something else, they would have left and said they had gotten their story, but you wanted to make sure they got the real story, and that was around mental health. So I just want all those who are viewing to know that you're not only a passionate advocate, but you're an effective one, and you know how the process goes, and you've been great in working within the process to advance change. Thanks again, Jason, for having me.
No, Patrick, thank you so much. And we certainly can bond. I only get introduced as a couple relatives. You get introduced as the relatives of this whole list of people. So I get that too. But I will say this, speaking of relatives, you hit the nail on the head. Not only is my grandmother a true advocate for mental health, but she's by far the best politician in the Carter family. And I think everyone in the family would agree with that. In addition to celebrating her, and I know that what she would certainly want us to do today is to talk about the future. And I think this moment in time, as we are obviously on a virtual meeting in the midst of a pandemic, and as Paige mentioned in the opening here, we also are in the midst of a very stressful moment in our nation's history, both because of the polarization in our politics and because of the reawakening and the continuing discussions around racial injustice in our country. And those sort of have become known as sort of 2020. And this moment, 2020 in our history, I think it has, and it is beginning to change a bit of the discussion around mental health and how we address it. And I would love Congressman Kennedy to throw it back to you to see if you could comment on these unprecedented times that we just discussed, and whether you think that 2020 and the swirling issues that are around our nation and our world have begun to normalize conversations about mental health, or whether it's making it easier to talk about it and other issues. And if you want to kick us off, I would appreciate it.
Sure. So obviously, as you mentioned, we are living in unprecedented times. The public health epidemic of COVID has definitely created such a anxiety and fear for people, and clearly a major dislocation economically for so many of our fellow Americans who now have the added stress of not only a deadly illness, but also the potential for a total economic insecurity. And then, of course, as you mentioned, there's a pandemic of racism that once again has been uncovered and brought to the light in our nation's consciousness. When you think of that combined with the toxicity of our politics today, it's not unsurprising that most Americans report feeling overwhelmed by the current environment and feeling real stress, which some of us are more resilient to deal with than others, but that's true of all illnesses. Some people have predispositions to get certain illnesses, others don't. And that's been true with mental health and addiction. But when you have this kind of environment, there's no one that isn't touched because everyone can relate to what anxiety is today. Everyone can relate to what depression is. And with the spike in prescribing of benzodiazepines and in addition to antidepressants and a whole host of other things, I think everyone is getting the feel that this has got to be something that's incorporated into overall health. And the irony is the real impact of COVID is going to ultimately be mental health and as well, because if you look at the impact on suicides and overdose and the fact that all studies show that there's going to be delayed kind of impact of that, so that we're really going to be facing this for quite some time. Employers have to deal with this, government has to deal with this, communities and families. And so I think that we might have a real window, if you will, into making the changes that have been advocated by Mrs. Carter for so long. I'll just conclude by saying my wife, Amy, is a public school teacher, now a candidate for Congress in New Jersey. Her main focus is social emotional learning in school because she's seen how so many of the kids in her classroom have suffered. And of course, that's even greater today because they're all feeling the same effect that their parents are, but they don't have the coping mechanisms to know how to deal with this. And so that's why we need a systems approach, like both President Carter and Mrs. Carter advocated for, that encompasses criminal justice, education, labor, healthcare, and so forth. It just has to be comprehensive. And I'm so honored to join all of you for this historic occasion and continue to discuss what your agenda is moving forward.
No, thank you. And that certainly we all are confronting and seeing the issues of mental health be pushed into that forefront in real ways. My wife is a school teacher as well, and my children are virtual learning. And there's so many issues that are out there in the way that we talk about it and experience it. And even in a family like mine, which has been discussing the stigma associated with mental illness for my entire lifetime. Well, Kari Cobham, you lead the Rosalynn Carter Fellowship for Mental Health Journalism, and Congressman Kennedy mentioned how successful it has been and how good it is to have journalists who are driving the discussion in a well-educated and helpful and impactful way. Have you seen a shift in the conversations this year in news stories about mental illness? And what's your take on sort of this moment for the discussion surrounding mental health?
Thanks, Jason, and good afternoon. It's really good to be here with all of you. We are seeing more and more. The program was founded, as you know, by Mrs. Carter in 1996, and the conversation has changed so much in the ensuing decades. And I think how much we've seen people talking about mental health and normalizing the conversation around mental health over just the last several months has been incredible. And so our program is hearing more from media outlets, I think nationwide and globally, who are looking for mental health experts to speak to people, what the impact of the pandemic will be, not just now, but after the pandemic. And it's directly in line with some of what we've been doing with the mental health program over the past year or more. So under Mrs. Carter's guidance, the mental health program, we've been working to ensure the full implementation and enforcement of parity in insurance coverage for behavioral health in the U.S. And so we've been focusing on enforcement in Georgia by convening the Georgia Parity Collaborative, which has about 20 nonprofit organizations that address mental health and substance use in Georgia and nationwide. And the goal of that collaborative is to raise awareness among the state leaders and so that we can advocate for evidence-based policy reform. Now, a huge part of what we're doing is the public understanding part of parity, and that's supremely crucial, and that's where the Journalism Fellowships program comes in. So this year, one of the things that we are focused on is launching a collaborative of multiple newsrooms that takes a deeper look at the state of mental health insurance coverage in their communities from an investigative and a solutions journalism standpoint. And from our perspective, that really follows the increasing trend of newsroom collaboration to produce strong journalism and to initiate that positive change. So what we're planning to do is we're going to start with our network of mental health journalism fellows who have already reported on parity. And we're aiming for the collaborative of local and national newsrooms to publish coordinated coverage in the coming year on the impact of the lack of insurance coverage of mental health and solutions that have not been explored or implemented.
That sounds like a great way of sort of taking advantage of the window that Patrick mentioned there. And I think, Kari, even in this moment, I think you're going to win the best Zoom background for the moment right now. But Sammy Kumar, you are in charge of the Carter Center's work in Liberia and globally. And we see, and we've heard from both Patrick and from Kari about how we've been gaining some momentum in the United States. I think we've all experienced that in some way, but also globally. Can you, and I'll just say that, when I was in Liberia last year or in 2018, the army of mental health clinicians that have been trained by the Carter Center's program is really incredible in a country that is beset with a huge number of mental health issues and PTSD and otherwise from having spent decades at war. And so really addressing issues in some of the most difficult places to address them is one of the things that the Carter Center does in many of its programs. And we appreciate that program enormously. What can you tell us, speaking more globally, about what have you seen in terms of prioritizing mental health at the WHO or the UN, and what does that mean for country resources and other things that are going on outside the United States?
Absolutely. Mental health is increasingly getting center stage in the global arena, and it's been a loud and resounding call, especially this past World Mental Health Day, which happened on October 10th, for increased investment in mental health. We're seeing this come from a lot of places, low, middle, and high income countries who are seeing the burden of this challenge and trying to find ways to address it. At the country level, I think I would focus on two things. The first is having dedicated budgets for behavioral health or mental health and substance use management services. And the government of Liberia, for example, has done that recently. After years of dialogue and building the infrastructure and frameworks to get that all in place, they have that dedicated budget line to be able to support those services, and that will hopefully grow and continue to grow in the future. But these dedicated resources make it possible for mental health to remain a priority, especially when, for example, we have health emergencies like COVID-19, which are taking a big toll on populations throughout the world, or when we need to put in use the policies and the frameworks that governments put in place for mental health, and for people to receive the care and services that they're needing and demanding. The second element, I think, fits into this context that Congressman Kennedy and Kari have also mentioned, is that we're faced with so many competing priorities for the same funding. And so the integration of mental health into other health priorities, into other development priorities, is what's going to be key. And so in Liberia, we've been focusing on this, as well as the financing element, looking at how do we integrate mental health into, for example, primary healthcare initiatives like maternal and child health, or into other development priorities like education and other sectors. And that approach is game-changing because it allows us to address mental health both holistically, but also make the most of limited resources that we have at our disposal.
And that ties in directly with what Congressman Kennedy was saying about the United States and all of us needing to integrate these processes into our schools, into the discussion. And we'll come back to Kari's point about insurance in a second. Let me, Congressman Kennedy, let me ask you this question. One of the things, as I mentioned earlier, that we have grown up in my family talking about and discussing is what we call stigma. And as my grandmother mentioned, that she's not sure that it will be gone in her lifetime, but I anticipate that that's a very long time from now, and it is clearly decreasing at some level. But you still have real disparity with respect to insurance coverage for persons with mental illness, and that is an element of stigma that really is impactful. It's not just the way that people feel. It's that, in fact, people are not getting access to what they need. Can you give us an idea of where we are in 2020 with the public having access to coverage for mental health care and substance use disorders? You're on mute, I think.
Sorry.
Okay.
First, let me.
That's the line of 2020.
Exactly. Let me thank you for the way that you described persons with mental illness. And they aren't their illness. They're people that have an illness. And these may seem like very small distinctions, but they have huge consequences, as Sammy and Kari can tell you. And I think that this is about discrimination. Because, as you know, we've never made as much progress as we'd like as a nation against racism. But what we've done is made some major progress in outlawing the practice of racism. We have so much further to go. But, in addition to the Civil Rights Act and the Voting Rights Act and the Fair Housing and Fair Employment, those types of major bills, what we need to do is call this out as discrimination. I think that to the extent we normalize total integration of mental health into overall health, and the less that we see it as separate, in a way that is kind of marginalizing and disparaging because it's not given the same reimbursement, respect, and so forth, I think we make this a perceived as a whole different thing for the next generation. So I agree. I think your grandmother's right. I think for a good deal of time, especially for an older generation, it's hard to overcome those old attitudes and biases. But for a new generation, I think that's going to change. And it's going to change more rapidly if they grow up in an environment where this is just normalized, where when they go to school, they get a checkup from the neck up on their ability to address adverse childhood experiences, with so many of them having suffered that, and knowing what their risk is and knowing what their resiliency is. I mean, as you know from your wife, they check for scoliosis and your hearing and your eyesight and making sure you have the inoculations. We need to approach this and say, why are they leaving the most important fundamental aspect out? And that's ability to learn. You can't learn numeracy and literacy without the ability to mediate your emotions and ability to absorb information. And that should be something that as a nation we strive for, so that we're not looking at mental health simply as a negative, like you need mental health, but something as Americans, we all want to improve ourselves and get, more better looking and more successful in business and, whatever it is. And it would seem to me if we tap into this notion that mental health helps you optimize your capabilities. And for those with real disability, it helps you become more resilient and deal with disabilities and really mitigate the impact of those disabilities. So just along the spectrum, mental health can be such a force multiplier. I think that's going to help change the perspective of mental health as something that people should fear being labeled with, as opposed to this is something you ought to embrace if you want to be perceived as a strong person who's able to have additional capabilities because they're seeking to understand how to better manage their feelings, emotions, and to the extent they have major disabilities, to manage those disabilities.
Yeah, it's almost like we talk about physical fitness all the time, and then we don't necessarily talk enough about ensuring that we take care of ourselves, to your point, from the neck up. I certainly know that in my life and in the sort of just even in my law firm, which considers itself to be very progressive in all these ways, and it's small enough to do this, we still have a hard time sometimes addressing and talking about these issues. But this year, so many more people are confronting them in their own lives that I think we're getting better at it. But no doubt we have ways to go. And the policy implications, to your point, of the discrimination against persons with mental illness is real. And I think that discussion and the effort to drive awareness to generate policy change is something that I'm going to make Kari Cobham talk about now. When we talk about awareness, when we talk about changing the dialogue, so much of that has occurred through our media and the way that people take information. What are some examples of the Carter Center and the mental health journalism, or just journalists in general, really driving some policy change that where you went from awareness to real action?
So, since we've been talking about the global impact, I want to kind of stay on that vein.
Sure.
Because we began mental health journalism trainings in Liberia in collaboration with Sammy's team in 2013 to build on their culture of journalistic storytelling, which is particularly impactful in West Africa, where mental health stigma, as we know, is so prominent. So as an outcome of those trainings and the initiatives that we put in place and some of the stories that the journalists in Liberia have continued to produce, journalists went on to form the Mental Health Reporters Network. And that is a platform for journalists locally to provide additional training on their own and to promote the broader development of network support for journalists. So in partnership with MHRN, we went on to launch a mentorship program where our fellows are supporting the Liberian journalists in their mental health reporting. And I think what we have seen is, Sammy talked a little bit about where we have seen the impact of the work, and we've seen the laws being passed in Liberia and the mental health system continuing to be supported. An important part of that has also been the work of the journalists. And so telling the real stories, putting faces to mental health, removing the stigma by normalizing those conversations has been an essential part of shifting policy within the country. And if we want to talk about here domestically in the US, I mean, over the past few years, we found 1 in 7 fellows, their stories have directly impacted public policy in the US, whether that is on a federal level, a local level, or just within hospital systems in their communities and things, and just raising that level of awareness and giving people the information to ask questions and hold officials accountable has really helped to drive change here in the US, but we're seeing that across the seas as well.
Yeah, and that's one of the aspects of the program that's remarkable is how many different countries it operates in. What can you give us just a quick right back at you, Kari? Synopsis of where the program is operating in addition to Liberia you mentioned?
So we partner with MHRN, which is the Reporters Network that I talked about. But the fellowships themselves, we have a program that's based in the US, of course. We have a program that is based in Colombia that was recently expanded to now include all of Latin America, which we have been very excited about. And we're also in the Middle East, in the United Arab Emirates and Qatar. In the past, we've been in South Africa, New Zealand, and Romania as well. And some of those programs continue to operate. So we're seeing, we're seeing a global shift. It's not just happening in the US, but we're seeing a global shift in these conversations, but also in additional coverage in the media, because I think people are realizing now that mental health is not something that just impacts people who may live with a mental health disorder. It also is impacting everyone right now. I don't think there's anyone who's been going through this pandemic right now that has not been affected, whose mental health has not been affected. And I think we're seeing that, a reflection of what the audiences are looking for and the coverage that we're seeing.
That's remarkable. I think thank you for the update and the sort of the scope of what's happening and the realization, of course, that this is one of those things that cuts across national boundaries and really unites as people as a common human experience. And that common human experience, the other, in addition to journalists, these days so many people are influenced by high-profile individuals who share their own personal stories. And if I know, Congressman Kennedy, you've shared your own personal story in books and in many other platforms. Obviously, I think as an influencer, and you've seen other celebrities and famous people, public figures speak out. What role do you think that plays in having people speak out and tell their own stories? What role do you think that plays in reducing stigma and giving people hope, if they need it, that recovery is possible and that there's, we can confront these things as communities and as families?
Thank you. Well, first of all, I never voluntarily outed myself. I had a roommate from drug treatment who sold his story to the National Enquirer about being in treatment with me for $10,000. I thought it was the end of my political career, right. And then it turned out to be the beginning of my political career and advocacy for mental health. It ended up being the best thing that ever happened to me. Although at the time I didn't think that. But it allowed me to be sponsor of a bill that, frankly, no one else was that anxious to take up because they were worried, frankly. What would be the next questions? Did the person sponsoring the bill have a mental illness? Did someone in their family have it? Have they ever been treated for it? Were they on medications? What kind of medications? Blah, blah, blah. And so luckily for me, my story had sort of been out there and I had a little bit more freedom to sponsor. And I might add to folks watching, I was the youngest member of Congress from the smallest state in the country in the minority party, and I got to be a prime signatory on the bill, which, as we all know, is really telling on stigma because most popular bills are immediately snapped up by the most senior members of Congress. So it says a lot that I got that dubious honor at the time, obviously. Is something I'm very grateful for having had that opportunity, in spite of the way that I was the default position on who was going to sponsor it. I wrote my story in a common struggle. Even though I was the sponsor, I did not appreciate the fact that I had a chronic illness. I mean, I knew intellectually all about the illness, but I couldn't have the insight in terms of my own struggle. And I think that characterizes these illnesses is that people often don't know. They're the last to know about their own suffering, even though everyone around them does. I will say finally that being public was very helpful to my own recovery because I constantly had people who were in recovery approach me because I was like one of the few people they knew who shared that same struggle with them. And that was a big help to me to feel less isolated. So, not being anonymous, again, it wasn't a choice of mine, but ended up being a very positive thing. So I think the more we kind of, are more comfortable talking about, the more we'll find people who can connect with us. And of course, that helps us, in a very selfish way. The reason why we have recovery is one of the tenets of our mission is because in helping others, we feel less alone. And that is a big antidote to these illnesses being as pathologizing as they otherwise would be, because the pathology comes from the isolation and the secrecy. As we say in recovery, we're only as sick as our secrets. So there is a lot to be said about being more public. But I certainly understand, especially as you said, Jason, about the workplace. Are you going to open up? You don't know whether it's going to impact your job. Certainly, I counsel my 12-year-old daughter not to share too much on social media because we know in 10 years from now they can source all that stuff and hold it against her in a job interview. So these are very tricky things for people to come out with.
Well, I think that's important, and I'll say this: as far as people speaking out, your comment that speaking out helped you because it broke down the barriers for others, and it really brought more people into your orbit is remarkable. And I think the leadership. So often we think about celebrities, Lady Gaga or others, talking about mental health issues as really positive. But for me, the greatest leader in my community has been a relatively young associate at my law firm who came to me and said, look, I have this issue that I need to address, and this is how I think we should address it. And her coming forward, to your point, was difficult given the stigma in the workplace and other things, but it really broke down so many other barriers. There's a lot of opportunities for people to speak out. And as it is scary and in these other ways, it is still necessary in all these contexts. There's real opportunities, I think, for leadership in this issue in a variety of different communities. Let me ask you, Sammy, about that. I think oftentimes we think as common as the human condition is around the world, often we think, there's places that are very different than the United States. Liberia is one of them. Do you have thoughts on how important it is for people in Liberia to be speaking out about?
Definitely. Advocacy in Liberia has been instrumental and will continue to be instrumental in working towards mental health and well-being for all Liberians. We have worked closely with a mental health service user group called Cultivation for Users Hope, And they have been a driving force behind a lot of the change we're seeing. For example, the dedicated budget that I mentioned earlier, but also how people use the services that are available, the quality of those services that are available, and as Kari mentioned, positive and accurate messaging and journalism around mental health. But that advocacy has also been reinforced by support and action from various stakeholders, which has helped it go a step further. For example, in terms of policies and frameworks I mentioned before, the Carter Center has worked with Ministry of Health in drafting and passing the 2009 mental health policy, as well as the 2017 to 2021 National Mental Health and Strategic Plan. And that has promoted mental health and well-being nationally with multiple different targets for the country to move towards, including, as you referenced, the growing number of mental health clinicians. And that's the second element, having a workforce that can support the demand. In Liberia, we have over 340 mental health clinicians now, 120 of whom specialize in child and adolescent mental health, which is amazing. Over 500 healthcare workers who are trained in World Health Organization's MHGAP certification. And that's in addition to the growing number of teachers, administrators, police, journalists, pharmacists, faith and traditional leaders, people from all different sectors who have different mental health trainings under their belt to better support the people that they're serving.
That is a remarkable achievement in a country that is very different than this one, and that is, confronting so many issues. It's remarkable. Let me ask this. I mean, just for you, Kari, having heard about Liberia and the number of people who are speaking up, do you think that the American public understands what mental health parity actually means if we are going to treat it and stop the discrimination as Congressman Kennedy mentioned? Do you think people understand that? And if not, what can we do to help change that?
I mean, I think that if folks may not understand exactly what we mean when we say parity, but folks definitely understand when they apply for mental health services through their insurance provider and it gets declined, even though their insurance provider is supposed to cover that. And so I think that an important part of our messaging around parity is communicating that not just what it is, which is that you have rights to be covered for mental health services by your insurance company, but to understand that if you are denied, that there is something that you can do about it, and that if we collectively are able to be educated and we know, okay, this is not okay, this is actually a law where we're supposed to be covered for mental health services, the same way we would be if I broke my leg or if I broke my arm. Understanding that you have rights around that, I think, is key. So if we know, communicating with people, one, what exactly parity is, and then two, communicating that there is something that you can do about it, I think that will be an important element here in moving the needle in the next year or so as we go through COVID, because I think we need to understand as consumers of health services that we also have power. And the more that we know, the more powerful we can become, and we can hold the feet to the fire of the people who are withholding services from us, especially if they're supposed to be providing it.
So I think that type of education is valuable. I also think, as Patrick said earlier, this is going to be a trailing indicator, right? I mean, the impact on mental health is cumulative, and a lot of folks, they're sort of walking around, even these days, just getting more and more afraid. I know my kids are, and that's a question, and I'll ask Patrick after this, but I'm going to ask Sammy first. About schools and about integrating these services and understanding what parity means if we're addressing things in schools. I know we have a program in Liberia that's dealing with schools. Tell us what we're doing there, and then when you're done, I'm going to ask Patrick to talk a little bit about what can be done in schools in the United States. Sammy?
Sounds good. Yes, prevention is a big part of our work both here in Georgia and in Liberia. And in Liberia, we're also looking at school-based behavioral health. We've been working with 7 schools in Liberia to have school-based clinics attached to them, and those are headed by those child and adolescent mental health clinicians that I mentioned. And the evidence there is that when those clinicians are situated in those schools and in those school environments, they're able to develop a better rapport with the students. They're more likely to learn about some of the challenges that students are facing. And generally, we can look to see better outcomes when those relationships are strong and being formed. That's one area of work. Another is working with schools, school leadership, teachers, administrators, families, and students. And so we have these things called parent advisory groups in some of our schools in Liberia. And those are venues where we can facilitate discussion between those different stakeholders so that we can better understand each other's perspectives and the challenges that they're facing. And I would say the last area is in terms of training, and again, the development of the workforce in this education sector is how are our teachers and administrators prepared to take on these challenges? So we have a school mental health manual that we've adapted to the Liberian context, and they're being trained in that. We have a brain science curriculum so that they can better understand brain development and what challenges students may face. And so those are just some examples of adapted tools that work in the Liberian context to help move that needle forward.
But let me ask you this before I pass it to Congressman Kennedy. What, do we? That sound, we have counselors in Georgia, and we have the ability, I think, to provide some services in our schools. But how does that compare? I mean, I assume that what you're talking about schools in Liberia that are so differently resourced than the ones that we're talking about in the United States. I mean, where do those resources come from, and are people excited to talk about it?
There is uptake of those services. We do have good turnouts at these parent advisory groups, people who want to see their students supported and who want to understand this issue more, both from the educator side and from students and families. And we are also doing it in a way that connects these school systems to the mental health clinicians and the mental health referral network, so that there is a continuity of care and you can refer services when needed to the broader healthcare system.
That's great. And Patrick, let me throw that almost the same question to you. I mean, talk for a minute about the importance of parity for children and the ability to integrate or sort of receive services at school. And then, as Sammy just mentioned, sort of connect from school into these other services, outside of the school context.
Well, thank you. I mean, I think to the narrative of parity is medical civil rights. It's saying we don't want this separate and unequal system of care. We want integration. That's a narrative that people in America can understand, and they can understand discrimination, even if they don't have much sympathy for those of us with addiction and mental illness, because the way these illnesses manifest themselves are often very alienating to everyone around us, as we know, given the fact the criminal justice system is the single greatest provider of mental health services, which should tell us a lot. So I would say that what we really need is a new financial system. I think that this is not a question of having enough resources. I think we have enough resources. The problem is we're not spending it right. And I think what we need to do is have that long-term ROI, return on investment, because right now payers and even the federal government, state governments, they do these annualized budgets and it changes from year to year, and payers are constantly needing to, get their quarterly earnings, and they just don't have, our country does not have the incentive to invest in the kind of preventive measures that saves all of us money, saves the government money, saves payers money. In Rhode Island, we had all the payers put into a prevention fund on a capitated basis based upon their market share for prevention, to pay for the things that none of them individually would pay for. And why did they do it? They did it because it was going to make for a healthier population, which they would all one day cover, because we know how quickly life moves. And it makes such sense to invest early. And it's not beyond our ability as a nation with such creativity to come up with those new financial mechanisms. And if we do, then what Sammy's talking about you guys doing in Liberia will be something that we expect in every public school in this nation. We should be paying for nurse-family partnership. I mean, it's just incredible that even to this day, we don't acknowledge that the high risk that many mothers are facing, it puts them and their baby in jeopardy. We know that if a parent isn't well, the chances of that child having a decent shot are reduced. So we have to keep in mind, it's not simply about reaching the children in school, it's also reaching their parents. And that's the kind of holistic family approach that needs to take place if we're going to transform this system.
Well, let me ask you this. How do we get there? I mean, you've mentioned a number of different stakeholders that have come together in a variety of contexts. I mean, what in your mind is the coalition that we can help put together that will achieve the type of both financial models and sort of just general sort of pervasiveness of these programs? What are you looking at, sort of politically and otherwise, private? Talk to me about how we get there.
I have a very big self-interest in being here. I think the Carter Center can really be a force for immense change in this next year. I think, should we get a new president and a new Congress, the opportunity to address these things is something we can never miss. We have to be prepared for a historic chance to really transform things. The impact of not only the prevalence of mental health, but the impact of a financial breakdown where our states are all under huge economic stress because of the impact of COVID. This means we cannot do business as usual. This means proposing those new financial systems, which never would be able to get off the dime in a pre-COVID world because they had too many entrenched bureaucracies. Frankly, everything's up in the air. There are going to be universal cuts across the board. We already know that if we're going to try to make up for some of these states' huge deficits, it won't be enough. These states are going to be under enormous stress to consolidate and rethink the way they do government programs. My point is that we as a community need to come in and tell states, here's how you can do a much better job combining your criminal justice system, which is totally inefficient. And as you reform that, to make sure we do not criminalize race, criminalize addiction, criminalize mental illness, here's how we integrate all of those dollars for policing, where so much of our policing budget is just transporting people with mental illness and addiction. Then you've got adjudication, you've got court time, you've got incarceration, you've got probation. Ching, 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 ching. Dollars start adding up really quickly. Imagine what we could do with those dollars. We have the huge delinquency, all because of kids not having the ability to mediate. And with very few dollars to invest early on, we get such a big payoff. We know the integration for medical care and the fact that medical care is off the charts if you're not treating underlying mental health and addiction conditions. So my point is that the case will make itself if we properly align incentives and get those systems, as Mrs. Carter and the president did in 1980 with their Mental Health Systems Act implemented. And this would be a great opportunity to finally achieve a lot of what they were looking to achieve with that historic bill.
Well, I can guarantee you that my grandmother watching from planes is excited by your enthusiasm and would be happy to help take up that mantle with you. So we will continue this discussion. I think we have about 7 minutes left to respect everybody's time, and so that gives each of you maybe 2 minutes to talk to us about what you think are the major issues. Sort of the most important, I would say, call to action about what we need to do over the next year. Patrick just laid out an important one. Kari, why don't you start, and then Sammy, and if you'll talk, Sammy, a little bit globally, and Kari about the way that we can focus on this program, but what it is that you see as the most important things we can do in that call to action, and then we'll let Congressman Kennedy conclude that. You're on mute, Kari. The moment of 2020 is always there. You're on mute, but not for long. Go ahead.
Well, I have 2 young kids and they live here, so I'm trying to spare everybody the noise of them running around and crawling on me. But I would say on an individual level, I mean, we talk a lot about the changes that we need in policy and that we need to see in systems. And by all means, we are definitely working toward those things. But, you know, if you're sitting at home and you're watching this right now and you're wondering, what can I do on an individual level to make sure that that there is fairness in how mental health is covered? I would say if you have health insurance, you just know that you absolutely have a right to coverage of mental health and substance use services. So if you're denied, speak up, reach out to your insurance provider and let them know this is the law. Reach out to your state legislature, your governor, your members of Congress. The Kennedy Forum has a parity registry where you can register and let them know that that you were denied for this coverage that you were supposed to be approved for, and they're keeping track of that, and that they're keeping track of those stories and helping folks advocate. So you can do your own advocacy for yourself and for your neighbors and for your loved ones and for your friends. So just do not forget, you have a right to have mental health services and substance use services from your health insurance company. And if they do not cover it, speak up.
Thank you so much, Kari. And we'll hear your kids speak up in a second, hopefully, I'm sure. Sammy, what do you see out there in the coming year that you think is a good call to action?
Yeah, I think it's short and sweet for me, and that is echoing others: invest in mental health and invest early. We are really seeing the momentum take off with global mental health and financing global mental health in countries all over the world. And we need to use our voice to advocate for that, to continue to advocate for that, and to do that here at home as well. I mean, we can look to our representatives, to our government, to our systems to see how they're using and allocating the resources that we have so that we can have mental health care and service provision as we need it. And the second element, I think, is to learn from other experiences globally. I think there's a lot that can be shared across contexts, even though it's not 100% applicable. There are elements that really thread through different scenarios and situations, and that can be applied and learned from. And so hopefully this next year will create more opportunity from that. We can learn not only more about what's being done in Liberia and how it can be applied elsewhere, but what other contexts have done successfully and effectively in improving mental health care for their people.
And I just think it's remarkable that we've talked about Liberia not only as a place where we may replicate some of those programs in neighboring countries or in other countries that are developing, but we heard Congressman Kennedy earlier say we could do some of the things in Liberia, we'd like to do them here in the United States. So that sharing is real. Congressman, what's your call to action? This is the second time I've asked you this question today, and I apologize maybe, but
no,
I feel like you got more.
I've got a couple of calls of action. I think we need a comprehensive agenda, mapped out. I'm thinking politically, obviously. When I was in Congress, there wasn't sort of similar efforts in mental health. And by the way, mental health is addiction. And we call it mental health and addiction, but it's the same. That every committee in Congress knows what they can do to advance this cause. In education, housing committee, I guarantee 90% of my colleagues don't know that the housing committee is one of the most crucial committees for mental health because of the need for stable housing. And then the labor committee, who would know, but job training for people who are going to be producing the next high need categories of jobs. My point is that we need to really map out what we want in a system. And then, by the way, we need to have a much more mobilized political advocacy on a bipartisan basis. We tried to do this, I think, as a successful first start at mental health for us. On a bipartisan, Senator Gordon Smith and I chaired that. And the idea there is when people like my wife run, who are great candidates for mental health, we ought to have a button that says, here's everyone in your congressional district that cares about this issue, whether they're mental health, whether addiction, whatever the diagnosis, whatever the reason, they care, and they're going to hold their public officials accountable. And by the way, they're going to participate in the political process. Until we do that, we're never going to get the change we seek, because Frederick Douglass was right. Power concedes nothing without demand. And what we need to demand these changes that we're talking about today.
Amen. That's wonderful. I agree. I know, as I said, my grandmother agrees, and for 50 years, she's been making that demand,
Yes.
and really, and including wielding some power. And so it has been, as we celebrate her today, and as we appreciate and say thank you, Congressman Kennedy and Sammy and Kari, y'all do incredible work at the Carter Center. We are all very proud of you. Patrick, we are proud of you and our relationship and our partnership, and we look forward to continuing it. Thank you to everyone who was watching today. I think that you can be inspired and know that there is a lot to be done. There is a real opportunity to do it. And as we look forward to these next few months and years, we certainly have our work cut out for us, but we've also got a lot of tools at our disposal to do it. If you are interested in more about my grandmother and her commitment for the last 50 years, you can go to cartercenter.org to see our video and a new timeline of her 50 years of mental health work. But I tell you what she would really want you to do is what Congressman Kennedy said and what Kari and Sammy said, which is focus on this, know your rights, know you're going to stand up for them, and be there for other people as we confront this. But we are all committed in many ways to being a part of the type of infrastructure and advocacy infrastructure that Patrick was talking about as we confront these issues and as we continue to push. So thank you very much to everyone. Sammy, Kari, Patrick.
Thank you, Jason.
Thank you.
Congressman
Thanks
Kennedy,
to everyone at home.
Kari.